Hello everyone, welcome to sqadia.com, and in this section we will talk about some infective causes of vaginal discharge. And we will talk about the bacterial vaginosis, which is very common cause of vaginal discharge. Then other is candidiasis, and then third one will be trichomoniasis. All these can lead to vaginal discharges. So bacterial vaginosis is a very common cause of vaginal discharge, and this is if you see, these are the normal vaginal cell here. This is the nucleus and normal vaginal cell, and these are the clue cell which are present in the bacterial vaginosis. Here, this is very clear picture under the microscope of the bacterial vaginosis. Normal cell, and these are small clue cells. That's indicative of the bacterial vaginosis. And what causes bacterial vaginosis is usually there is depletion of lactobacilli. These are the lactobacilli. In the vaginal wall is covered by the lactobacilli. It gives the protection to the wall of the vagina. So when they are lost or depleted, usually it becomes very easily get infected or damaged. So depletion of lactobacilli is one cause of bacterial vaginosis. There is a vaginal discharge which is very malodorous, fishy odor. It's called the fishy odor, which is present in the bacterial vaginosis. pH is very high. It's more than 4.5 usually. So high pH is also present in bacterial vaginosis. pH is measurement of the hydrogen ion concentration. So when the pH is acidic pH prevent the growth of different bacteria or different organism. But once the pH is increased or become alkaline, that causes the vulnerability of the mucosal wall to the different bacteria. Diagnosis is done by Gram stain. Gram staining usually shows the bacteria, and these clue cells are also visible. So Gram staining is done to see the bacteria under the microscope. And bacterial vaginosis is treated by the metronidazole or clindamycin. Two medicines are very effective, metronidazole or Flagyl. Flagyl is common, and clindamycin is also used for bacterial vaginosis. So diagnostic feature of the bacterial vaginosis, one is the presence of clue cell, and then high pH, more than 4.5, fishy smell or fishy odor, and then there is also the discharge, vaginal discharge, which is homogeneous off-white discharge. So 4 features are very common in patients with bacterial vaginosis. This is the slides under the microscope. In this one you can see this is the normal lactobacilli. These are all it's a normal slide with lactobacilli. This is the slide showing candidiasis here, candidiasis. This is the slide with the bacterial vaginosis. And this is the slide of trichomoniasis, in which you can see flagellated trichomonias or flagellated protozoon. And this is the unstained slide. It's the black and white, no stain is used in this slide. Next is the vulvovaginal candidiasis. This condition is caused by the Candida albicans. So, species that cause candidiasis is Candida albicans. Candida is normally present in the female reproductive system, also in vagina is the normal flora. But sometimes when the immunity becomes low, or when there are some infections or inflammation, the infection becomes common. So here you see this is this white lining of the vaginal wall. This is due to the candida infection. Candidiasis also cause oral thrush in the mouth. You see the white coated tongue, very common in the newborn babies, and when their immune system is low, or when they are preborn or low weight babies, they are preterm deliveries, this is also common infection. So symptoms of candidiasis is itching, irritation, and white curdy vaginal discharge. These are three very common symptoms. Itching and irritation is common. Signs are erythema. Erythema is the redness of the skin. Edema is the swelling. And then also there is fissure. Fissure is cracking of vulva and vagina. And this cracking can be sometimes due to irritation, dryness, itching. So that can lead to fissuring or the breaking down of the skin. And antifungal drugs are used for this disorder because candida is the fungus. So antifungal and creams are used for the treatment. Then trichomoniasis, here you see it's a flagellate protozoan, Trichomonas vaginalis. Protozoa Trichomonas vaginalis causes trichomoniasis. There is a vaginal and urethral infection. Asymptomatic in 50% of the cases. There are no symptoms present. NAAT is used for diagnosis. This is again nucleic acid amplification testing. It's a molecular test done on the nucleic acid. So, and then diagnosis is very good diagnosis with this NAT testing. And systemic metronidazole is used for the treatment. So usually for trichomoniasis, metronidazole IV flagyl can also be used for treatment of trichomoniasis. So it is the asymptomatic in 50% and can affect the vagina and urethra also. So dysuria is also common with the trichomoniasis along with vaginal discharges. So that was all about the bacterial vaginosis, candidiasis, and trichomoniasis. All three can lead to vaginal discharge and diagnosed by testing on the vaginal discharge. Thank you for watching sqadia.com.